Hello, my name is Terra Karl, and today I'm going to discuss physician-assisted suicide. Imagine being a young, vibrant, healthy 29-year-old woman living in California. You've recently married the love of your life, you're trying to start a family, and your future looks bright. And then you start having headaches. You go to your doctor, and he tells you that you have a terminal brain cancer, which has no cure, no treatment options, and is expected to kill you within 6 months. How would you feel? What would you do? This is an undated picture of Brittany Maynard. I retrieved this picture from people.com in an article written by Nicole Egan. The scenario that I just described is exactly what happened to Brittany. Brittany made headlines in October of 2014 when she brought attention to a growing phenomenon, physician-assisted suicide. Brittany and her family made the decision to move from California to Oregon so she could participate in their Death with Dignity program, so she could die in her own terms, not her cancer's terms. Research shows that physician-assisted suicide, also known as PAS, should be an option for terminally ill patients because the process is heavily regulated, the sole responsibility lies primarily with the patient, and more Americans are supporting the Right to Die movement. Today I'm going to discuss the benefits of PAS for terminally ill patients. I will explain the regulations. I will also explain how the patient is responsible for their own death, and how more and more Americans are supporting this Right to Die movement. First of all, let's talk about the regulations that PAS has. According to PAS expert Dr. John Westerfield, any patient wanting to participate in the Death with Dignity program needs to be 18 years of age or older. They need to have a sound mind to make medical decisions, and they need to have a terminal illness which is expected to kill them within 6 months. The patient will then need to meet with a participating physician 2 times, at least 15 days apart. A participating physician is one who is willing to write a lethal prescription for a patient to ingest to pass away. The patient must also send in a written request to this physician, and the written request needs to be signed in the presence of 2 witnesses that are not related to the patient. After these regulations are completed, there is an additional 48-hour waiting period, and then the patient can receive the prescription. The prescription that is usually prescribed is either pentobarbital or cyclobarbital. Now that I've discussed the regulations for PAS, I will talk about how the sole responsibility lies primarily on the patient. Dr. Michael Gill is a professor of philosophy at the University of Arizona, and he states in an article that the #1 reason patients choose to participate in PAS is a loss of autonomy. Simply put, autonomy is a person's ability to make decisions for themselves. And it makes sense. As a terminally ill patient becomes more and more ill, they lose the ability to make simple decisions such as what to eat, what to wear, and where to go for the day. And then the decisions become more complicated, such as, where do you want to die? Hospice, home, or a hospital? That choice gets taken away from them. With PAS, however, the patient is the one to decide, first off, whether they want to even fill the prescription, when they want to take the prescription, where they want to be, and who they want to be with. According to the Oregon Health Authority, 1,173 Oregon residents have received the lethal prescription since the program's inception date. And of those, 752 ingested the medication. The median age of patients participating in the program was 71 years old. 94% of them were Caucasian. 97% chose to die at home. After ingesting the pill, the patient was typically unconscious after 5 minutes, and within 15 minutes, the patient had peacefully passed away. While most terminally ill patients are in full support of PAS, it is now appearing that more and more Americans are also supporting the Right to Die movement as well. According to an article written for Time magazine by Emily Barone, Oregon passed its Death with Dignity program in 1997. They were the first state to pass this program. Washington State followed in 2009. Vermont passed its program in 2013. And New Jersey just voted a law in November of 2014 favoring a new program, Death with Dignity program. Now, Montana and Hawaii do not have actual programs in place, However, they do have statutes saying that if a physician prescribes a lethal drug by request, that physician will not be prosecuted for murder. Research shows that physician-assisted suicide should be an option for terminally ill patients because the process is heavily regulated, the sole responsibility lies primarily with the patient, and more Americans are supporting the Right to Die movement. Patients must adhere to strict regulations in order to receive the lethal prescription to end their life. They then are the ones to decide when and where they desire to ingest the drug and pass away. And more states, such as Vermont and New Jersey, have passed laws recently supporting the patient's right to die how they wish to. This is a picture of Brittany Maynard, retrieved from Sanjana Farbarov's article written for dailymail.co.uk. This picture was taken 2 weeks before she passed away. While she is still a beautiful woman, you can definitely see the effects of the terminal brain cancer on her body. Thanks to news stories chronicling Brittany's story, it is being proven that physician-assisted suicide is a humane way to die, and it must be made an option for more terminally ill patients used to end their suffering. Thank you for your time.